artificial intelligence in healthcare. So rules, implementation, challenges, and solution. So no, it's running. So first, AI in healthcare, a rapid growing field. So AI been like the scientists, computer scientists community been working on AI for a long time. Maybe like you can say like 2 decades ago. But we just like only in the 2020s, people start listening, hearing about AI news from ChatGPTs, Google Gemini, and the DeepSeek from China, and and like just the AI race to start heating up on the 2020s. But it been around for a long time, and right now there's a lot of people talking about AI in other industry, finance, logistic, and healthcare. And this thing, I'm going to focus on healthcare. Yeah, healthcare, AI and healthcare, a rapidly growing field. Why AI in healthcare is rapidly growing? Because it's going to help in some applications areas. First is going to be diagnostic imaging, drug discovery, precision medicine, remote monitoring, and admin and billing. Yeah, and I'm gonna just talk about a few of them. One of them is diagnostic imaging. Diagnostic imaging. Google, Google Gemini, they have a model called AlphaFold. AlphaFold is a model that actually can read the human protein in the body. It can read the cells and it can tell if this protein is good for the body or not, if this protein will fit this type of person or not. And it been doing great. The company name is DeepMind. They're doing great. They're doing some testing, and the company is growing. And some people are getting good results. Some people are still. We need to make sure that it actually give the accurate results up, so people can actually benefit from it. The same thing is remote monitoring. Remote monitoring. I'm just gonna tell a small short story. My mom, she had a car accident before. Thank God she's doing all right. But at that time, when she did the accident, her body was feeling pain. We went to the hospital with her. She was in the emergency meeting. I'm in emergency room, so I was with her there because she doesn't speak English. So I was there just translating to her, and I just realized that most of the time in the nurses hospital, I don't say like the nurse needs to be there 24/7 just bothering you, but most of the time the nurses are gone. Like, and that's just and the patient, which is my mom, was just laying there on the bed, and even if she's trying to ask for something, she cannot ask for it. If she tried to call someone, she cannot call someone. Even I'm the one who I used to go there outside, call the people, and then get her the help that she needed. So monitoring is going to help a lot because it's going to be like you can put it on your phone. You can have something. You can have an app of the hospital, and then you can just press a button, so you can alert the nurses and let them know that someone need to come and help them with something. Maybe go to use the restroom, update about their status and how the process is going. So this is part of how AI is going to help in healthcare. The same thing in admin and billing. Admin and billing is just, this, you can say it's already been there, but the good thing is that AI actually can actually help you. How do I know that? Because I try an app before. Is a link. It's called Linktree. It's an app that they have an AI agent. An AI agent actually can help you if you want to cancel a subscription. The AI can actually go and find your account, your bank account and everything, and then just cancel you from the subscription. And then the next day you're gonna find that there's no more, you are not subscribed anymore, and you can actually you can actually trust that. The same thing in field, because there's a lot of fake insurance, fake accounts. AI actually can help people in that in that arena a lot. If you find there's something fishy about an insurance or something, you can actually go ask AI, and AI can go and do the research for you about this. Scrap the whole web and let you know if these people are legitimate, if it's actually trustworthy or not. So that's amazing. That's a part of it. Yeah, as I was talking about diagnostic and all this, you can see it is already reduced from 3.4% to 0.5. That's actually amazing. In cancer positive note, that's amazing because cancer was the big monster for the last like a lot of years in humanity. Many people, if you hear someone they have cancer, that means they go to die. But right now we have hope, and that's actually what I like about AI, that we have hope to know what we're dealing with and to know how we can find a solution for it. So uh, that's a good thing. Like especially cancer is one of the human challenges, but with AI we will have hope to actually beat it and cure people from cancer. All 100 stroke center in England deploy AI tool for near instant CT analysis by late 2024. Yeah, and many people are just adopting it, not as just someone who's gonna replace them, but as someone who's going to like actually no as a machine, who's going to be assistant for them and give them that push that will take them to the next level in their discovery and problem solving. The number two is going to be implementation of AI in hospital. Yeah, this is the hardest part, which is to put it in action. Because many people can say AI, 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 but if the AI didn't is not trained well, it's not working well, people don't understand it, don't get it. That means it's just going to be there as a hindering, not as a solution. So we're going to see implementation of AI in hospital, how leading healthcare institutions are adopting and integrating AI into clinical and operational workflows. So hospital Yeah, hospital AI adoption at a glance is a glance. This is the company, I mean, a hospital. There's a 71 of hospital using predictive AI with ERS, EHR, yeah, 7% increase in domain specific AI tools adoption, FDA cleared AI medical devices, core implementation domain. Yeah, one of the most important part is this is the domains are most important, which is HR integration, robotic surgery, and admin automation. Yeah, this is the more these are the most significant uh, tools that people need to actually implement them right. So that means AI will work right with them. If these three are not working good, then yeah, you are just wasting your time with the AI, especially in the hospitals. Uh, the HR integration mean that the data human AI tool integrate with electronic health record for predictive analytic and calculation decision support. Yeah, that's the place that actually most of the decision making by human take place. And if AI can be integrated there, it can help them with making the right decision and actually tracking and monitoring their patient in a great way that make it possible for each patient to actually know what's going on and how they're going to get how they're going to get cure and treatment and how the process is going to go, and at the same time it's going to help the doctor to have a clear map of where the patient is coming from and when the patient is going to go. And the AI will just be assisting and supporting that. The same thing with the robotic surgery. Robotic surgery, I think robotic surgery has been here for many times. But at the same time, right now we're using AI and we try to make the robot look like us. So so the patient is gonna feel, it's gonna feel not gonna feel weird. So, but at the same time, AI powered surgical system improving recovery by 35% and reducing complication by 22%. They seem like low numbers, but that's how improvement works. It's hard to start from somewhere, and it's gonna keep going up. So the robotic is a great addition for any hospital to actually have and use AI to help them with their work. Lastly, is going to be the admin automation. Admitting 30% of prior authorization, reducing staff cost by 35. Yeah, and admin is just about how can we automate the job that human being doing repetitively. For example, booking scheduling. The AI can actually help the patient if you just call through the phone or go to website. Just let the AI let the AI know uh, what you want, what type of doctor, what type of treatment you're looking for, and the AI will go and just give you the go book the appointment for you, let you know when is the right time to come, who's the doctor you're gonna meet, and how the process is gonna go. The same thing with the billing, we mentioned earlier, admin and billing. The AI can do this thing for you. So the thing, it's not just gonna make human being lazy, but at the same time, it's gonna make human being powerful, and at the same time, it's gonna make them fast, and they have multiple hands. more than two hands, it's going to be more because the AI will just do the repetitive job for them and without any tiredness. So that's the advantage. Leading institution cases, we have three well-known hospitals. We have Mayo Clinic, Cleveland Clinic, and John Hopkins Clinic. The Mayo Clinic, they have 32% increase in low injection fraction diagnosis. 2000 clinic are using abandonment document. Wow, that's a lot. That's a lot. That's amazing. 35% improving in post-surgery recovery. Negative 22% reduction in surgical complication rate. AI-powered chart summarizing for inpatient care equivalent outcome to cash lead diabetes prevention. Look, diabetes is getting attacked, and diabetes is getting a cure. So I'm so excited about I'm so excited. You can see my face because it's actually going to help people if people using with the good intention and just focus on attacking those sickness and those disease and actually come with a cure. So this is the third part. We're going to talk about the challenges of AI in healthcare, critical barriers that must be addressed for safe, equitable, and effective AI deployment in healthcare. That's amazing. So key challenges facing AI in healthcare: data, privacy. Yeah, everybody wanna wanna have a good data. Want to have a safe data. If my data is not safe, that means my information is out there, and anybody can just take information about me because we know sickness is a vulnerable state and nobody want to be their data to be outside and just people know that they're sick, they're ill, they're whatever. So everybody want to be in a safe place until they get what they get treated and they go back. So we have something called HIPAA Protect Modern AI. Healthcare data breaches reaches near record levels in 2024. Balancing AI data need with patient confidentiality remain critical. Yeah. What's just saying is that there's something called HIPAA compliance. HIPAA compliance is just a medical compliance where uh, the hospital will have a data which will have your own information safe and secure with them. And what's the rule or the law that's gonna make this possible or come to pass is that they're gonna have HIPAA compliance. So that's what HIPAA does. Just that means you will protect the data of the patient. That's it. We have algorithm biases, resultantly fragmentation on clinical trust and interpretation. Yeah, first, we say like AI is a right now is a new thing in field of healthcare and people are actually testing it. And there's a lot of people, a lot of doctors, a lot of patients don't trust it. Why? Because they don't think that it still is ready. Some people think it's not ready. Some people they don't want it at all. But it's gonna take time for people to actually like and adapt to the machine. Like it's gonna take time for you to just accept that this robot no more than this human, or maybe this robot is going to this human is going to use this robot to heal me. People are we still doubting that, but the process is it's got to take time, and people need to just be calm. Yeah, and here I'm gonna handle the challenges, which is overcoming the challenges, governance framework, privacy preserving technology, interoperability, try to say that 10 times, standards and cross-sector collaboration. So this is the same four boxes that we saw in the challenges. We're gonna address them here right now. Governance and standard. WHO guidance on AI ethic 2024 and global initiative on AI for healthcare provide international framework PPTO model enable organizational governance. We have privacy and bias mitigation, federal learn the eventual privacy and fairness. MLN address data concern explainable, enable clinician auditing of medical decision. We have interoperability solution HL7 FIR adoption reduce integration time by 6%, semantic mapping and NLP bridge gap across heterogeneous HR environment. We have comprehensive clinical phases. So in the nutshell, it's all about trust. People don't trust the AI because they don't know that if AI can actually help them or not. If the AI is like it's just the suggestion, because at the end of the day, AI is just giving suggestion. If the suggestion that AI is giving to the patient, is it gonna work or not? And I believe is all about, yeah, there's governance and standards. There's a certain percentage that the AI need to know and need to have knowledge about, so it can help the patient. Yeah, the government standards. So the goal of this was just the trust. Yeah, if the AI has a certain knowledge, it has certain training, pre-training about how to do this job, great, how to diagnose this disease, right? Then people will you know what will like will use it as a system. But if the AI didn't get that threshold or didn't get to that point, then yeah, I believe that we're just gonna discard what the AI say and then just focus on human to human and just deal with the sickness and do our best. But I believe that the more AI train and learn about our human being and what we go through and our diseases, the AI will improve and get better. People actually will trust it long time on the yeah, just people trust it more. So I was just gonna give example about the phone. Like when the phone come, people didn't trust it. My data is there. I'm gonna put, but right now you can see like people are literally stuck on their phones 24/7, 24/7, and that's bad. But people, human being are so as human beings we are so extremists. Either we hate something so much or we love it something so much, but we need to find the truth is always in the middle. So the goal is just gonna be to train the AI, learn about human being. People will trust it more, train it very good and have knowledgeable doctors so they can actually know that this AI just giving a suggestion. It's not a real solution until the doctor confirm it and make a decision about it. So the key takes is AI and healthcare is projected to grow from what uh, to 26.6 billion to 187 billion by 2030, with 71 of hospital already using predictive AI. So that's amazing news, but at the same time, I just keep telling, it's all about the human being need to know that there is another player. They need to play with another player in the field of AI, and the more they know understand each other, the more the solution and the result would be favorable. Real world results are measurable. 35% of faster recovery, 32 better diagnosis rate, 35 cost reduction in admin tasks, privacy bias, regulation fragmenting, and clinician trust remain critical barrier to equitable development. Yeah, that's the challenges, and the solution can be success require coordinate government, WHO, privacy preserving tech, interpretive standard, and clinician training. These are the reference. These are the hospitals. And yeah, thank you, and thank you, sir, and thank you for listening, and thank you for the whole class. Thank you for on behalf of my team, Team B, and thank you for this whole class. I really enjoyed. I learned a lot from it, and hope you like this presentation. Thank you.